Have you ever considered getting a dental implant, dreaming of a perfect smile and a problem solved for good? Every single day, countless individuals across Russia and indeed the world undergo this transformative procedure, hoping to replace a single missing tooth or even an entire row. They meticulously save their hard-earned money, brave the operating room, endure the inevitable pain, and patiently wait for months for their bodies to heal, confident that their dental woes are finally behind them. Yet, for many, this hopeful journey takes an unexpected and disheartening turn. Just a year or two later, complications mysteriously begin to surface, sometimes necessitating a painful second surgery. What if I told you that hundreds, if not thousands of people suffer this setback because they were never informed of a crucial, often overlooked truth? The shocking reality is that dental implants are simply not suitable for everyone, and proceeding without this vital knowledge can lead to immense frustration, discomfort, and wasted resources. Don't let yourself become another statistic in this silent dental dilemma. Stick around, because in this video, we're going to uncover the essential insights you absolutely must know before considering implants, revealing when they're truly a viable solution and in which critical cases they might utterly fail to take hold. To truly understand the implications of dental implants, let's first demystify what they actually are and how they work within your mouth. Imagine an artificial root, meticulously designed to mimic the natural root of your tooth. This small, often screw-shaped post is expertly placed directly into your jawbone, acting as the bedrock for your future tooth or dental structure. If we were to look at it from a different angle, visualize a patient with a missing tooth. An implant can be seamlessly integrated into that space, becoming virtually invisible to anyone but the patient themselves. Once this artificial root is in place, a healing period of 2 to 3 months, or in some rarer cases up to 6 months, is crucial. Following this integration phase, a specialized connector, known as an abutment, is securely screwed into the implant. This abutment serves as the vital bridge upon which your custom-made dental crown, your new visible tooth, will be carefully positioned. In essence, dental implantation is a sophisticated process that rebuilds your smile from the inside out, offering a fixed, durable solution to tooth loss. One of the most critical aspects you absolutely must grasp before embarking on the implant journey is the healing period, a phase often underestimated by patients. After the implant is precisely positioned within your jawbone, a significant waiting game begins before your permanent crown can be fabricated and placed. This waiting period typically spans anywhere from 2 to 3 months, although in more complex or individual cases, it can extend up to a full 6 months. This isn't just arbitrary waiting, it's a vital biological process known as osseointegration. While we often casually refer to the implant taking hold, the scientific explanation is far more fascinating. Tiny bone cells called osteocytes actively begin to grow into the intricate threads of the implant itself. It's this microscopic, organic embrace between your living bone and the titanium implant that ultimately creates a strong, lasting fixation. Initially, when the implant is first screwed in, it's primarily held in place by mechanical retention from the threads. However, over the subsequent weeks and months, these dedicated osteocytes meticulously work to establish a robust biological connection, ensuring the implant becomes a true, integrated part of your skeletal structure. Another practical consideration that might come as a surprise is the potential for a period of time during which you will temporarily be without a visible tooth. Naturally, after the implant is placed, you must wait for it to fully integrate before the final crown can be added. This often leads to a common question, particularly from those missing a highly visible tooth, like an upper central incisor. Does this mean I'll have to walk around toothless for several months? The answer, fortunately, is nuanced and depends heavily on your specific clinical situation. In some favorable circumstances, the implant can be placed, and either a healing cap or even a temporary plastic tooth can be immediately attached, effectively bridging the gap and maintaining your aesthetic appearance during the healing phase. However, there are scenarios where an immediate restoration isn't advisable. In such instances, dentists offer alternative solutions. while going without a tooth for a time is one possibility. Doctors can also explore options like an adhesive bridge. This involves attaching a small bar to your neighboring teeth, onto which an artificial tooth is meticulously crafted, offering a temporary aesthetic solution. It's crucial, however, to be mentally prepared for the genuine possibility that you might experience a period where a visible gap exists, underscoring the importance of discussing these temporary options thoroughly with your dental professional. Beyond the aesthetics and the healing, you should also brace yourself for a natural physiological response to the surgery: significant swelling. This can manifest as swelling of the mucous membranes within your mouth and visibly on your facial tissues. The exact intensity and severity of this swelling are influenced by a multitude of factors, ranging from your individual body's unique healing capabilities to the specific nature and complexity of the implant procedure performed. Interestingly, this swelling typically reaches its peak intensity around the third day following the implant placement, before gradually subsiding. In a somewhat counterintuitive but often observed trend, many dental professionals find that the more pronounced the initial swelling and, especially, bruising, the more robust and effective the subsequent healing process tends to be. This is because a strong bodily reaction to surgical intervention signals that your system is actively channeling its protective resources and reparative capabilities directly to the affected area. This powerful biological response often leads to superior healing outcomes, with strong bone formation evident in X-rays, particularly after bone grafting procedures, where significant new bone growth can be observed within just 6 months. Crucially, before committing to dental implantation, you must also confront the sobering possibility that, despite everyone's best efforts, the implant might simply not take or could even be rejected by your body. The reasons behind implant rejection are varied and complex. One significant factor lies in the individual characteristics of your body. Sometimes a patient's system simply doesn't tolerate the titanium alloy, or perhaps minor impurities that, despite modern purification techniques, might remain in the titanium. Historically, such impurities were a more common cause of rejection. A second major reason stems from pre-existing comorbidities or underlying health conditions. Later in this discussion, we'll delve into specific diseases that can render dental implantation impossible. Should an implant fail to integrate, or in simpler terms, fall out, a strict protocol is followed. Dentists will typically contact the implant manufacturer and order additional tests to understand the root cause of the rejection. Once the reason is identified, the implant can often be calmly reinstalled, sometimes even on the very same day or after a period of healing. It's rare for an implant to spontaneously fall out without warning. More often, the issue is detected during a routine X-ray checkup. In such cases, the problematic implant is carefully unscrewed, the area is meticulously cleaned, and a new one is placed if conditions permit. Alternatively, the site might be left to heal for 3 to 6 months before a new implant is introduced, allowing for optimal tissue regeneration. Beyond the clinical aspects, many patients find themselves overwhelmed by the perceived financial burden of dental implants. It's a common scenario for individuals to visit multiple clinics, still without a clear understanding of the overall cost, often believing they must pay the entire intimidating sum upfront. However, a significant advantage, frequently overlooked, is that the total cost is rarely demanded all at once. Savvy clinics understand that this can be daunting, and they often divide the total amount into manageable, staged payments spread over the course of several months. For instance, the first payment covers the initial implant placement. The patient then has a worry-free period of 2 to 3 months while the implant integrates. Upon their return, a second payment is made for the placement of the healing abutment. Finally, after another 2 to 4 weeks, the crown is placed and the final payment is due. This strategic breakdown of costs into typically 3 payments over approximately 3 months makes the entire process far more accessible and less financially intimidating for many individuals, turning a seemingly overwhelming expense into a manageable investment in their oral health. Now let's shift our focus from the challenges to the truly remarkable, often less obvious advantages that make dental implants a groundbreaking solution for tooth loss. For many, the paramount benefit lies in the preservation of neighboring teeth. Consider a scenario where a single tooth is missing. In the past, the only viable solution was a dental bridge, which unfortunately necessitated grinding down and crowning the two healthy teeth adjacent to the gap. Implantation completely bypasses this invasive step. With an implant, a single artificial root is placed and a crown is affixed, leaving your invaluable neighboring teeth entirely untouched, healthy, and poised to last for a significantly longer time. This preservation alone is a monumental leap forward in restorative dentistry. Furthermore, dental implants boast an exceptionally high and predictable success rate, a statistic that consistently hovers between an impressive 98% and 99.8%. This level of reliability offers profound peace of mind to patients. Another undeniable advantage is the sheer comfort they provide. When contrasted with removable dentures, which can often feel cumbersome, unstable, and require constant removal for cleaning, implants allow for a fixed, non-removable dental structure. Patients experience unparalleled comfort, forgetting they even have an artificial tooth and never having to worry about anything dislodging or falling out. Beyond comfort and aesthetics, implants play a crucial role in preventing bone atrophy or bone loss. When a tooth is lost, the jawbone in that area no longer receives the stimulation it once did, leading to a gradual softening and recession of the bone. By placing an implant, the bone is re-engaged. It recognizes the load placed upon it, and this stimulation actively prevents further bone loss, maintaining the structural integrity of your jaw. The peace of mind extends to a tangible guarantee. Each implant comes with a special certificate, complete with an individual identification number. This certificate offers extensive worldwide coverage, meaning you can present it at virtually any dental clinic globally, and they will recognize and assist you with your specific implant system. Finally, consider the remarkable combination of speed and durability. The actual procedure of installing a single implant can take as little as 20 minutes. And as for durability, with diligent oral hygiene, proper care, and regular dental checkups, ideally every 6 months, at least once a year, a dental implant can realistically last you a lifetime, offering a truly permanent solution to tooth loss. Despite these incredible benefits, it is absolutely crucial to understand that dental implants are not universally suitable. Certain medical conditions represent significant contraindications, meaning they make the procedure impossible or highly risky. First and foremost is uncontrolled diabetes. If your blood sugar levels are not effectively managed by medication and remain high, the body's ability to heal and integrate the implant is severely compromised, making implantation an unsuitable option. Similarly, active cancer is a clear contraindication. Patients currently undergoing oncological treatment will find that dental implantation is not recommended due to the body's compromised immune system and the effects of therapies like radiation and chemotherapy on bone healing. Another important contraindication involves patients taking certain medications, specifically bisphosphonates. These drugs, often prescribed for conditions like osteoporosis or as part of cancer treatment, can significantly interfere with bone metabolism and healing, posing serious risks for implant integration and bone health. Immunodeficiency conditions or diseases, such as AIDS, also contraindicate dental implantation. A weakened immune system dramatically increases the risk of infection and hinders the body's capacity to heal properly after surgery. Finally, a less obvious but equally critical contraindication is age under 18 years old and in exceptional cases even up to 21. This might seem surprising, but during these developmental years, the dental and jaw system is still actively forming and maturing. Placing an implant prematurely can interfere with natural growth and lead to complications down the line. It is vital to respect the body's natural developmental timeline for optimal lasting results. Understanding these contraindications is not just important for you, but for your loved ones as well. Please, share this invaluable information with your family and friends, or better yet, share this video directly. By doing so, you can help prevent countless individuals from making potentially costly and painful mistakes when considering dental implants. If this video has provided you with clarity and helped you make a more informed decision about implants, please show your support by giving it a like and subscribing to the channel so you don't miss out on future essential health insights. Take care of yourself and those you cherish.